Hi, good afternoon, everybody. My name is Ben Cattell-Knoll. I'm a technical assistant specialist here at the National Alliance to End Homelessness. And we thank you for joining us for, I believe, the 7th webinar in our Emergency Shelter Learning Series, webinar series, on the keys to effective emergency shelter. Today, we're going to be talking about the 5th key to effective emergency shelter, which is using your data to evaluate and improve performance. If you joined us before, you know the drill on this, but just a couple quick housekeeping notes. We do have a lot of folks on the webinar today, and so your lines are on mute, but we do want to hear from you still. So there's a little chat box on the right-hand side that you can say hello to us and to your fellow attendees on. But more than anything, we would love to hear your questions. As you hear our wonderful speakers today all present, I hope it raises some new questions for you, and I imagine many of you are bringing questions yourselves into this webinar about how to use your data more effectively and what to be measuring. So please submit those questions in through the question box. It should be on that menu on the right-hand side of your screen. And so we'll be tracking those throughout the webinar and asking as many as we have time for at the end. As usual, we are recording the webinar today, and so the webinar itself, the recording of the webinar will be posted along with the slides following the presentation. So feel free to share this with any of your staff, other stakeholders, or whoever you think would be interested in this, as well as the rest of the resources on our Emergency Shelter Learning Series so far. So we have a wonderful panel of speakers today. I already introduced myself. I'm Ben Cattell-Knoll. You'll be hearing from me again in just a little bit. We're also glad to have Cynthia Najendra, who is the director of the Alliance's Center for Capacity Building, on the call today to talk about why data is important. And then we have two awesome providers who are joining us as well. Nichelle Carver from the Virginia Department of Housing and Community Development, and Andrea Eck from Northern Virginia Family Service. So we will be hearing from Nichelle and Andrea a little bit later about how they have already put some of these best practices into practice across the state of Virginia. So without further ado, I'm going to turn things over to Cynthia, who's going to talk about a little bit more about why we measure data and the importance of shelters.
Thank you, Ben, and thanks to everyone for joining us today. As most of you know who've been watching this learning series, we like to start off by talking about the fact that shelters play a critical role in ending homelessness for every single person and every single household that you serve, as well as for the people who still need your services. And so we acknowledge that emergency shelters are really just an important part of your system, and really that programs should be accommodating people's needs rather than requiring people to accommodate program needs. And this learning series is trying to help programs just be more effective at what they already do and in playing that important role in your community. So operating an emergency shelter is very important, incredibly challenging work in any community. This series is meant to help communities and shelters build on the work that shelters already do, that very important, very good work that you already do to respond to homelessness and shift practice in ways that are going to benefit people experiencing homelessness in your community, as well as help you take a systems and housing-focused approach to providing emergency shelter services. We have a series of webinars that you can find on our website. We will talk about the key elements to operating an effective shelter in this webinar, just touch it briefly. There are a number of other tools, as you can see, self-assessments, other tools, and guidance from other shelters and providers that have made this transition to a low-barrier and housing-focused model, and you can find all of that on our website. The learning series on emergency shelters and data is the 7th webinar in the series. If you want to go back and watch past webinars, here's some of the titles of those webinars. You can download the various tools and webinars that we have shared, and we encourage you to do this if you have time to go back and look at this with your staff, with your board, and really kind of get a sense for the whole package of tools. Here are some other tools you can download from our website. We have a shelter outcomes metrics form, which we will be discussing today. Ben is really going to walk you through that, and we're going to talk about how you can use that, how funders use that, how providers use that. That will be kind of the real focus of our webinar today. There are also self-assessments, some infographics, some videos featuring shelters who have made this shift. And importantly, our next webinar is actually this week. It's on June 28th, Increasing Access to Shelter, the Equal Access Rule. That's a really important one. We'll have folks from HUD talking about really how to make sure that your shelter is compliant with the Equal Access Rule. It's a very important and going to be a very helpful webinar. Throughout this series, we have been talking about how to retool shelters by aligning your shelter with these 5 key elements. The 5 key elements to effective emergency shelters are having a housing first approach, practicing safe and appropriate diversion across your system and at your shelter, ensuring your shelter provides immediate and low barrier access to people who need help, making your shelter housing focused with rapid exits to housing services, and using your data to measure your shelter's effectiveness and making shelter design decisions. Today, we're going to be talking a lot about making your shelter housing focused in terms of the outcome. So we want to talk about kind of how to make sure that you're getting those rapid exits to permanent housing and how to measure that. One of the most important places to start is to ask yourself what the goal of your emergency shelter is. What is your shelter trying to achieve? This will help determine what kind of data outcomes you should be collecting and evaluating. When thinking about the goal of your shelter, remember that an emergency shelter will get the outcomes that it is designed for. The determined goal of the shelter should be clear from the very start to guide the design of its built form, of its operations, of its service delivery, and expected outcomes. So this is a good time to really think about what is the goal of our shelter? What is the goal of our shelter? And if we're not sure what the goal is, if there are a lot of different goals, do we need to rethink that? Do we need to sort of really stop, take some time to think about what the goal of our shelter is and what we want it to be? So right now, ask yourself, what kind of shelter are you and which kind of shelter do you want to be? As you can see on the left, there is the kind of shelter that provides temporary shelter. Many shelters think about this as being their goal. That is usually the stated goal of a shelter. Often this is the way emergency shelters were designed from the beginning, to be sort of a hostel-like environment, meaning you're sort of checking out and checking in and checking out every day, right? So that's sort of like a youth hostel or a motel that you're coming in and coming out every day. You're meeting, your clients are coming in to meet their basic needs, getting maybe showers, being able to use the bathroom, getting their laundry, getting their mail. Sometimes there are some self-directed resource and information referral services, so people can come in and you might have some things posted on a bulletin board, or you might have some staff that can give some resources. There may be some light services. You might have a case manager or a couple of case managers to sort of help people kind of come up with goals for themselves and direct them to other resources. So that's kind of one goal of emergency shelter, to basically provide temporary shelter and meet basic needs. The other kind of emergency shelter, and this is the kind of emergency shelter that we have been talking about during this series, is the kind of shelter that ends homelessness for the people who are coming inside that shelter and for the people who are still being waiting to be served. The kind of shelter that ends homelessness aims to resolve people's housing crises permanently, aims to facilitate self-resolution for people who can basically get out of shelter and out of homelessness pretty easily with a little bit of help, aims to rehouse people quickly, reduce unsheltered homelessness, because having people who are sleeping outside in your community is also something that a shelter needs to think about, because that's partially often because they can't get into the shelter, maybe because of capacity, maybe because of barriers. So one of the goals may be to actually help your community reduce unsheltered homelessness. You want to help create better system flow, meaning you as a shelter are helping people move from homelessness to housing really quickly, helping people connect to coordinated entry in your community, and connecting people to housing search and other resources to help stabilize them once housed. We want to make sure that people are getting housed, but that they're able to stay housed, so they don't come back to shelter and they don't come back to homelessness. That's a very important one as well. And so if you don't quite know which type of shelter you are, or you are a blend of these two shelters, it might be time to stop and think about which kind of shelter you want to be, as this will really guide your design process. It will design sort of what your staffing looks like and what outcomes you really want to be able to measure and achieve. To be the kind of shelter that focuses on housing each person or household that comes through your shelter, you will want to use specific kinds of data to help you achieve that goal and know if you are making progress. Very importantly, it's hard to know if you're making progress if you are not looking at your data and at your outcomes. Shelters are used to sort of looking at bed nights and people served, people coming in and out. We're going to be talking about very different kinds of data today, and data that hopefully you're already collecting for your funders. That is why this is the fifth key to be an effective shelter: data to measure performance, and one of the most important. Let's start with these questions. Why do you collect data? Many of you may be reporting all kinds of data to funders, donors, and staff, as I said earlier. And it's important to ask why you even need this data. What is it useful for? Reporting data can feel like not particularly useful activity. It feels like you're putting a lot of stuff in, maybe into HMIS. It's not helpful to you unless that data is useful and actionable. Sure, your funders might be asking for it, but are you using it? Are you using it to make program decisions? Today we want to talk about why shelters need data to design better programs and get better outcomes, what data you should collect, and what that data can tell you about how effective your shelter is at resolving homelessness for the people you serve and how you can improve your services. I hear a lot that people say that they work at shelters and they're working to really get people better outcomes, to improve people's lives. To know if we're doing that, we want to know we want data to tell us whether we are sort of making people's lives better, if we're making sure that people aren't coming back into homelessness, if we're making sure that people are getting housed. And the only way to really do that well and thoroughly is through data. So first we should ask these questions, and sort of, I would get together with your staff, ask what data you're collecting, and how you're using that data to make staffing decisions, program decisions, policy decisions. If you're not sure how to answer these questions, this is really a good time to start asking them and working through the answers. Data should be driving your decision making, as I just said. Throughout any transition process to a new shelter model, how else are you going to know if this new shelter model is working? Data is what will help you really know if you're meeting your goals, and then help you evaluate how you're doing and know what to change, know what's working and what's not working. A performance evaluation cycle looks something like this. You collect data to measure performance. Ben's going to walk you through the emergency shelter metrics, which will tell you what data to collect that will help you to measure the most important performance outcomes. And you should report this data to your staff at least monthly. You should then evaluate what the data is telling you each month. How many people got housed this month? Did the average length of stay decrease or increase? Why? How many people returned to homelessness or to our shelter? Once you start doing this monthly, you can evaluate which policies and practices are working and which ones aren't. And then you can set new goals for your shelter to improve housing outcomes. If you already decreased the length of stay by 10% in 3 months, then you can try to reduce it by 20% in the next 3 months, if that makes sense for your shelter. It is important to remember that the first few months of data may not give you any discernible trends. It takes a while to really kind of get to that baseline data, especially if you've never collected this data. So at first, the data might be difficult to kind of understand what it means, but especially if you're a larger shelter. And you may want to look at the first few months of data before you evaluate what is working, what is not. But it is good to start at least reporting on these metrics so you can establish a baseline. And what that means is that you're really just going to start looking at your data a little bit differently. And it's really not meant to, if you're starting to serve people who have higher needs, as you will do if you are lowering barriers to shelter, doesn't mean that your outcomes have to be amazing at first. You're just trying to see what changes are really affecting your outcomes and even what your outcomes are. Right now, you have no idea what percentage of people are going to housing, what percentage of people are going back into homelessness. It would be helpful to know that if you want to know if your shelter is effective at ending homelessness. Here are some outcomes you should be looking to achieve. Decrease long stays. Some of you have some folks in your shelters that have been there for a long time. Some of you might not have long stays because you have a 30, 60, 90 day kind of arbitrary deadline for people having to exit. So that might not apply to you, but if you're looking for people who are long stayers, that might be a good thing to start with, because you can see sort of, well, why are people staying for so long? That will help you reduce how long people are staying in shelters if you start focusing on those folks. Increasing exits to permanent housing. This one's extremely important. If there's nothing else that you're looking at, try to increase your exits to permanent housing, because that's how we end homelessness, is getting people housed. Decreasing returns to shelter. So we want to get people into housing, and we want to make sure that they don't come back to shelter. Increasing shelter utilization. For some people, this is an important one, because people are not having their shelters full. And so while the goal of shelters is not to keep your shelters full, you do want to make sure that people are, you're serving as many people as you can, and that as you're serving them, their homelessness is becoming permanently resolved. Without measuring these outcomes, it's hard to evaluate whether your emergency shelter is effective at ending homelessness for the people you serve, and that's why these are so important. So this is a very, very important note, especially for funders, but as well as for providers. These outcomes work together. Just decreasing the length of stay without increasing exits to homelessness is not a good outcome. For example, if you have a 60-day, if you decide to say, well, let's just make our shelter stay 60 days for everybody. But if most people are going back into homelessness and not into housing, that is not a good outcome. You wouldn't want to implement an arbitrary length of time for people to stay in shelter just to decrease the length of stay. Rather, you need to think about increasing exits to permanent housing and decreasing the length of time people spend homeless. The only way to end homelessness is to help people get into permanent housing. So people often ask themselves whether there is an appropriate length of stay for shelter. And what we usually say is shelters should be trying to house people as quickly as possible by focusing on resolving the housing crisis for each person as soon as they enter shelter. And so there isn't an appropriate length of stay. But we want to make sure that we're thinking about getting people housed as quickly as possible, even in some, I know a lot of you don't have a lot of housing resources. You have a very difficult housing market. You don't have a lot of affordable housing in your community. But planning for a housing exit should start right away. If we don't start planning for housing exits with everybody that's coming into our shelters, it's not going to be a stated goal. Importantly, and this is really for the funders and for the system leaders out there, shelters need support from the rest of the system to be successful at ending homelessness. And so we really always encourage system leaders, funders, COC leadership to remember that shelters need support to be able to achieve these outcomes. This is something they really need help to do this from the whole system. They need housing resources. They need help connecting to the system. They need help with their data. So just to be successful, it's important to note that shelters need this kind of support. How can the system and its funders help to drive and support the transition of shelters to a low-barrier housing focus model? Here are some ways to do it. You can align funding contracts and outcomes, and today, luckily, we have Michelle Carver, a state funder, who's going to talk about exactly how they did that and how that worked out. Adding housing capacity, such as rapid rehousing and permanent supportive housing, to your system. Coordinated entry integration. We want to make sure that shelters are participating in some way in coordinated entry. This is going to make coordinated entry work a lot better, and it's going to make it a lot easier for clients to get housed. Implementing system-wide diversion, and analyzing shelter outcomes and support capacity building and training for staff. So that's really some things that funders and system leaders can do for shelters to help them achieve those goals. With that, I'm going to hand it over to Ben to talk about how to complete your metrics.
All right, thanks so much, Cynthia, and thanks to you all. We have some questions coming in, so we will get to those at the end of the webinar, so keep those coming in. So now we're going to talk through a little bit about how to complete your metrics. So this form is available as a download on the right-hand side of your screen. In that same box, you can see under where it says handouts, you can find this form, but this is also available on the Emergency Shelter Learning Series website that Cynthia mentioned at the beginning. So if you are watching this later on, you can find this form. It's a Word document, and you can download it so you can track these yourself. itself. But just wanted to talk through real quick this form, which you can now see in front of you, which is our emergency shelter outcomes metrics. There are 9 things that we're going to be talking to you about tracking that we think are important and that work together. So this is the sample report. This just looks at what 1 month would look like. I believe the form that you download will help you look at 6 months at a time. But we would really encourage you to do this regularly each month from now until forever, because you can really help to make sure you're accomplishing what you set out to accomplish, notice some trends that are happening in your shelters, and adequately respond to those, like Cynthia mentioned just a little bit ago. So again, you can download this and use it yourself. And we really, I can say that we've talked to some folks, and you'll hear from both Nichelle and Andrea later. When folks start to measure this, you may have heard the saying, what gets measured gets done. And we've really seen that with folks that have started to adopt this form. Once they've taken it on, adopted the key elements, and really focused in on these metrics, we've seen them make some pretty major improvements in a relatively short amount of time, because you are really responding to what's actually happening on the ground rather than just our perceptions of how we're doing. And we can see some real firm data to demonstrate whether we're on track or not. So without further ado, what I'm going to do is talk through each one of these metrics, each one of these 9 individually, just talk real briefly about what it is, about why we measure it, and how to calculate it. So all of these are also available when you download the form. If you ever get confused, the second page of the form does explain each one of these in some detail, but did just want to talk through them today with you so you can hear it if some of you are auditory learners rather than reading it, and also to see if you have any questions or clarifications about any of these. So let's start with the first 2. So the first, number 1, very straightforward. This is pretty much just the bed information, total count of beds that you report to your continuum of care for the housing inventory chart that you complete every year and that you've probably been completing for a long time. So this should be a pretty easy lift for you all. We did break it down between unaccompanied individual beds and family beds, just to kind of get a sense of who you're serving. Essentially, after the first time you complete this, you shouldn't need to be recalculating this each month, unless, of course, your bed count is shifting. Perhaps some of you are opening or closing a cold weather shelter, or occasionally sometimes folks will shift some beds. If, you're seeing an increase in individuals experiencing homelessness, sometimes folks might shift beds from families to individuals, or vice versa, from individuals to families, or just otherwise you're gaining or losing funding or adding or subtracting beds. So just keep track of your total bed inventory. So then number 2, this is the number of unique households that are served each month. So that includes any household that's newly entered that month, anyone who exited that month, and anybody who's stayed throughout the month, who neither entered nor exited throughout the month. So we talk about this per household, not per persons, because it gives us a better opportunity to kind of compare apples to apples when we're looking at programs that serve both families and individuals, or when we're comparing programs that serve families to programs that serve individuals. So we found that this works the best for most providers. Sometimes this can be a little bit tricky to calculate depending on how your reports pool. But really, when we talk about a household, whether that is a single individual, that's one household, or a family, whether that's, one parent and one child, that would be one household. Whether it's 2 parents and 3 children, even though it's 5 people, that would be one household as well. And so that's how we are encouraging you to track on this form. One of the things that you can do with these 2 numbers together is to get a basic sense of your utilization rates of your shelters. Are your beds mostly full? If they're not full, why aren't they full? And you can start to use that to see, do you need to shift some beds from one population to another? Are your barriers perhaps keeping people who otherwise could use shelter access from accessing your shelter. So this gives you a basic sense of whether or not you're utilizing the full capacity of your shelter, as well as kind of the flow through your program. So, if you're serving a lot more households in a given month than you have beds, that's suggesting that folks are really coming and going at a pretty high rate from your shelter, for better or worse, as we'll talk about here in just a second. So, number 3 and number 4 are also just pretty basic counts of folks. So number 3, we're looking at the total households who enter shelter in a given month. So in this example, we're looking at May. So anybody who entered May 1st to May 31st, we're counting them. That's whether they exited within the month or not, just the total number of new entries into shelter in that month. The number 4 is the number of total households who are exiting in the month. So again, whether they're exiting on the first of the month or the last day of the month, regardless of where they exited to, whether they were exiting to permanent housing or back to the streets, or you don't know where they exited to, how many people who had been staying in your shelter have exited over the course of the month. So those are pretty straightforward. Again, things that you are likely already tracking, that you're already, collecting data on in your HMIS systems. You know who is and isn't in your beds, but sometimes just looking at them in this way can be helpful to see, whether the inflow is matching the outflow, or whether a certain month you're seeing a lot of folks exit, and other months you're seeing a lot of folks stay. So it can really help to start looking at trends. Another great one to look at here then is number 5. This is another one that's just a hard count of people, and this is the number of households who are exiting to a permanent destination. So number 5 is a subset of number 4. Of all the households who exit your shelter in a given month, how many are exiting to a permanent destination? So what is a permanent destination? This could be, of course, somebody who has identified their own rental unit, or occasionally bought a house. Somebody who's moving into their own, personal housing unit. It can also include folks who are moving into things like a shared housing arrangement, rooms to rent, and it can also include folks who have, identified a family or a friend who's going to allow them to stay for what's more or less a permanent tenure. Of course, we don't know whether that's going to last forever or just for a couple of months, but anything that's not, somebody saying you can come and you can stay for 2 more days or 3 more days, but then you're back out again. So if they consider it to be more or less permanent, for the foreseeable future, then that can count as a permanent housing destination. What a permanent housing destination does not include are things like moving to another shelter, moving into an institutional setting like a jail or prison, or a treatment facility or a hospital. It also doesn't include moving into a transitional housing program, which is still considered a homeless resource. It's not to say that any of these exits are necessarily good or bad. We're just trying to track how many folks are exiting to a permanent housing destination. And so number 5 and number 4 are really helpful to look at together, again, to see what percentage of people are exiting your programs into permanent housing. And what does that tell you? Where are you seeing high percentages? Where are you seeing low percentages? And what might be going on there? So, and as Cynthia mentioned, we can't look at these in isolation of each other, right? So you may have a really high number of people exiting to permanent housing each month, but maybe that's a really low percentage of all the people who are exiting your program. So you may want to take a look at that and say, well, why are so many people exiting to something that's not housing? Vice versa, on the other side of that, you may have a really high percentage of people who are exiting your program to permanent housing. Maybe it's 80, 90, or 100% of all the people who are exiting, but that might only be one person a month. So, are you really having a good flow through your system? Could you be helping more people exit to permanent housing? So again, these are good things to look at individually as well as in connection with each other. So number 6 and 7, now we get into some fun, slightly more complicated math where we're looking at averages. So rather than just counting people, we get to do a little bit of division and look at how long they are staying in programs. So for number 6, the average length of stay in days for all households exiting the shelter to any destination. So that verbiage should sound familiar. Number 6 is a subset of number 4. So of all the households who exited, you have that total count. How many, what is the average length of stay among that population of people? So you calculate this by adding together all of the days that each of those people stayed, adding them all together, and then dividing it by the number of people who exited the shelter. If that doesn't make sense, hold tight with me for a second, and I will show you an example in just a minute. But before I do that, I want to talk briefly about number 7. So number 7 is the average length of stay in days for all households exiting to a permanent housing destination. So again, this wording should sound familiar. Number 7 is a subset of number 5. So of all of the households who exited to a permanent housing destination in a given month, what is their average length of stay in your shelter? And before I talk about calculating these, just to say again why we encourage you to measure this and look at these independently, it can be interesting to look at these together and say, do longer lengths of stay in our shelter correlate to better housing outcomes or not? So are you consistently seeing that the folks who are exiting to permanent housing have longer or shorter lengths of stay than folks who exit to any other destinations? So those can be really helpful to look at together, and even looking at them individually. Generally across the board, as you heard Cynthia say, one of the measures of an effective shelter is that we want to see that people are homeless for as short of amounts of time as possible. So as much as possible, we want to see these lengths of stay have a nice noticeable downward trajectory. There may be kind of a you're never going to get down to 1 day, of course. So that you may reach a kind of a plateau that you feel okay about in your performance, but especially when folks first start to look at these. We tend to see really high numbers because we know that there are folks who have been in our shelters for a really, really long time. And so the length of stay may be rather high. So again, just take a look at these and see if you can notice a general downward trajectory in the number of days that folks are staying in your shelter as well. So an example real quick of how to calculate these. So for number 6, which is the average length of shelter stay for all households exiting to any destination. So let's say there were 4 families that exited your shelter last month. So family 1 who stayed for 30 days, family 2 who also stayed for 30 days, family 3 who had been in your shelter for 60 days, and family 4 who had also been in your shelter for 60 days. So in order to calculate their average length of stay, we just simply add those 4 numbers together. 30 plus 30 plus 60 plus 60 is 180 days, so that's the total number of days. And then we divide that by the number of families or households who exited, so that was 4. So 180 divided by 4 is 45, so that gives us our average number of days for all exiters. So let's say we're looking at the same data, the same families, trying to calculate number 7, which is the average length of stay for all households exiting to a permanent destination only. So let's say family 1, 3, and 4 all exited to a permanent destination. So just family 2 exited to another destination. So again, we just calculate this in the same way, but we exclude family 2 from those calculations. So we take the length of stay for family 1, which is 30 days, family 3, which is 60 days, and family 4, which is also 60 days, so we get 150. And then we divide that by the total number of families, which in this instance was the 3 that moved into permanent housing. So we get 50 days as the average length of stay for all households who exited to a permanent destination. So hopefully that makes sense. As you know, for those of you who are working with a smaller number of folks where you only have 2, 3, 4 exits in a given month, you can probably do this by hand as demonstrated here. For those of you who are running much larger shelters, you should hopefully have access to all of this in a spreadsheet form, and you can develop some formulas that can help you calculate this automatically, which in a lot of ways is a lot easier than doing it by hand. And you can do that if you only have 3 or 4 folks staying in your shelter as well. So anyway, there are lots of ways to do this. But just wanted to talk you through kind of the mechanics so you understand what you're looking at and how to calculate this, whether you do it by hand or not. So then the final 2 metrics that I want to talk about today relate to what we call stayers. So before I say more about that, let's define what a stayer is. Well, this is metric number 8, total household stayers. And it says it right there. Stayers are households who entered in a previous month and did not exit during the same month. So for example, we're looking at metrics for May. If you're calculating for May, a stayer would be somebody who entered in any previous month, February, March, April, anything before May 1st, who also did not exit the shelter in May. So these are the people that are there solid from May 1st through May 31st. Those are your stayers, regardless of when they entered. As long as it was before May. So again, these numbers give us a sense of the flow through your shelter, how frequently people are moving in and out. So, again, Cynthia talked about looking at these in connection with each other. We don't want to, it wouldn't be great to see 0 stayers if the reason you're doing that is because you have an arbitrary length of stay that's 2 weeks or that's 30 days. So you would never have stayers that don't either exit or enter in a given month, but you're just arbitrarily saying, no, you can only stay for X amount of time. But that said, you also don't want to see folks staying for months and months and months, or even years and years and years at a time in your shelters, because as we know, shelter is not a home. We want to be ending homelessness and help people move into permanent housing. So again, number 8 is just going to be a hard count, the total number of households who are stayers. And then number 9 is the average length of stay for those stayer households. Just a quick tip about this. I'm gonna give you that example like I gave for the first one of how to calculate the length of stay for a stayer. It's a little bit more complicated than the other, but I do just want to say you'll know if you've done this correctly. Well, you'll know if you've done this incorrectly, because the number 9 can never be a number that's less than 30, unless maybe in the month of February. But these stayers, because again, they're there from the beginning of the month to the end of the month, and that means that all of their average length of stay is going to be at least 30 or 31 days, depending on the month. So just if you're seeing an average length of stay for stayers that is like 15 or 20, you're not calculating that correctly, because they would have to have been there for the full month. So how do you calculate that? I'm going to give you a really simple example of a small shelter that would just have 2 stayers. So to calculate number 9, let's say you're looking at, for May of 2018, 2 stayers, family number 1 who entered your shelter on February 1st of 2018, and stayer family number 2 entered your shelter a couple weeks later on February 19th of 2018. So in order to calculate this, we look at the number of days they've been in our shelter as of the last day of the month. So again, this is a calculation. You can do this by hand. It's really easy to do it in Excel, where you can just have the day that the household entered and the last day of the month, and you can subtract the day they entered from the last day of the current month, and Excel will spit out a number of days. So in this instance, stayer family 1, who entered on the 1st, has been in your shelter for 119 days. Stayer family number 2, who entered 18 days later, has been there for 101 days. So in order to calculate their average length of stay, again, you just take the number of days for everybody and add them together. So in this case, 119 plus 101, so you get 220 days. And then you divide that by the total number of households that you're calculating for, the total number of stayer households, which in this case is 2. So 220 divided by 2 is 110 days. So the average length of stay for stayers here would be 110 days. So that is a lot of numbers, a lot of data, a lot of math, which I know a lot of us didn't get into this field to do math. That said, like I mentioned, a lot of this stuff you can work into reports to pull these for you, so you're not having to do this math by hand every month. But hopefully this helps you understand what you're calculating, why you're calculating it, and what are the important factors to look at and how they may interact with each other. So I hope that was a helpful overview. Again, feel free to reach out to us if you have questions or challenges with that. Let us know how you're doing on these metrics. We'd love to hear from you. And so I think that's all I'm going to say about that. And so now we want to hear from some providers who are actually doing this. So I'm going to turn this over to Nichelle Carver from the Virginia Department of Housing and Community Development to talk about how funders are using Metrix and data to drive funding. So Nichelle, thank you so much for joining us. If you just want to say hi and introduce yourself real quickly, and then we'd love to hear what you have to say.
Okay. Hi, I'm Nichelle Carver, the Housing Program Manager here at the Virginia Department of Housing and Community Development in the Homeless and Special Needs Housing Unit. And I've been with the team for about 11 years. Initially, I was a program administrator and then moved up to program manager. So some of this, I can see the metamorphosis of the change in thought with shelters from when I started in 2007 till now, and I used to be a provider a long time ago. Way longer than I like to think about. But a long time ago, I used to be a provider, so it's nice to see the change in how we look at this. All right, do you want me to take next slide? Or do I control it?
No, that's fine. Just tell me when you want me to hit next. No worries.
All right, so for context, this is a map of Virginia, and I don't know, it's kind of hard to see, but the COCs, we have 16 continua of care. And one of those is the Balance of State Balance of State COC, and that's that peach color, all the parts that aren't like in color. And that is 12 different local planning groups that fall under our Balance of State COC. So in total, we have 15 COCs and 12 local planning groups. That's how we look at them, and that makes 27. So when I'm talking about the 27, we look at these 27 different COC local planning groups as a whole. And we have a responsibility on the state level to ensure there's service provision statewide. So even with the metrics, our job is not to use those metrics to not fund communities, but it's to get an idea of where communities are. And if there's a community that's struggling, we need to go in there and do some help. So what I'm going to talk about is kind of how we use the metrics during our application process, and what data we kind of pulled from it, and then how we figured out who needed some help around the Commonwealth of Virginia so that we knew where to go and put some energy. All right, next slide. So I just want to give you a little bit of data so you can see, sometimes when I talk to folks about the things that we're doing in Virginia, you know, it feels like maybe it's Pollyanna pie in the sky. However, our data says that what we're doing is following the right track. Since 2010, and I didn't put our 2018 numbers because they're still preliminary, but so from 2010 to 2017, our total homeless population in Virginia decreased by a third. That's pretty significant, and I really feel like it is related to we made moves to really focus on housing. And once we made that decision at the state level, it started to trickle down, and we go into communities and we talk housing every time we talk. Next slide. So our households with adults and children, our family households, that decreased by almost half, 46.5% in that 7-year period. Again, when your focus is housing, you start to see some pretty significant results. Next. And then our veterans. And so veterans starts in 2011 because we were calculating the data a little different in 2010. But with the focus on veterans, if you're not aware, Virginia was the first state to functionally end veterans homelessness. And that's pretty significant for us. We had resources that went towards it, but we also had messaging. And we went around and we talked in communities about how to make this happen, again, using the focus of housing. So these metrics, when I start talking about them, you'll see that it helps you to start focusing on getting people housed and not just sheltering folks. Next. All right, so just to kind of give you an idea of our funding process, and this is more for funders, but also for people listening to how this was done. We do a community-based funding application, so each COC is expected, or a COC local planning group, has to figure out what's the best plan to prevent and end homelessness in their community. And then what agency should be in that plan that they're going to put forth to DHCD. We have a panel review, and we review those 27 applications. After the review, we hold negotiations, and during those negotiations, we talk about how much money we're actually going to give the community, because normally we get requests for way more money than we have. We talk about the proposed activities. Sometimes the community will ask for more shelter money, but based on their metrics, they're not using the shelter they have. So we'll have a conversation about that's probably not a good use of state dollars, or state or federal dollars. So what are we going to do? You're not going to do more shelter. We need to figure out what needs to happen. And then also discussing the proposed grantees, because sometimes, and the Metrix is really helpful in helping us see this, but sometimes a grantee will be in there and they're not actually providing any service, right? And the proposal didn't give us an idea of why this grantee should be in the application. What will they bring that's different from what is already happening? And so that conversation will take place about whether or not that proposed grantee needs to actually be funded this year. And then we clarify any information presented in the application. So we used this year, and this was our first year using the metrics, and I'll talk about that in the next slide, but we talked about, there were metrics for Agency A that were concerning. And we had a conversation about what we saw in the metrics during the application, especially if the metrics didn't match the narrative. All right? And then we contract with individual organizations based on the application, that subsequent review, and then the negotiations. So it is a process that normally starts for us in like February, and we actually just finished our negotiations last week. Next slide. So first I'll say, okay, we started spring of this year. We released a more comprehensive application, and we didn't just have the mandatory requirement that shelters put in the application had to have metrics from July 1st, 2017 through January 31st, 2018. So that was a new requirement in the application. If you were going to have a shelter in this application, that shelter had to have metrics. There were no metrics, they are not going to be able to get funded. And we were very clear. We started that conversation before July 1st and kept it going all the way through the application. But we also asked questions about whether communities looked at that data to help inform decisions and gave subsequent points related to that. So it wasn't enough just to have your metrics, but you also had to say, hey, we reviewed our metrics, we reviewed our point in time count data, we reviewed this information, and this is how we came up with this proposal to you. And during our panel reviews, we also pulled the metrics up on our screen because we sit in one conference room for like a month. We sat for the month of April. And we pulled the metrics up on the screen when we would review communities and had discussions about utilization rates and comparing data to the narrative. So if an agent or if a community said, we have 0 shelter beds and we're really needing more shelter money, but all of their metrics said something different, that was something that we wrote down that we need to have a conversation about that during the negotiation. But that cost points because that didn't match. It meant somehow they missed what their data was telling them. So we asked some questions in the narrative, like I said, to try to get to those metrics. How is the community using their HMIS data, their community level homeless data in designing their projects and making changes and informing decisions? It is not enough anymore to have all this data and still apply for the exact same funding that doesn't match the data that you have in front of you. And communities felt that. The communities that scored high in our application really had conversations about their data and who was having really good outcomes and where they should put some of the money. And then we also asked them to describe their system's performance and outcomes in reducing the number of households entering the system and the length of shelter stay and people returning back to homelessness. So that length of shelter stay was important because we got to see a lot of information with stayers, and we could see when communities or agencies started trying to improve what was going on with the stayers in their shelters. Next slide. So Ben went over this in detail, but this is kind of just a look at what we were giving out to people, what we were giving out to agencies, and what we had in place to get better outcomes. I can honestly say after going through this process, poor performance measures did affect funding. It did. It was no way around it, because you would have a difficult time having poor performance measures and a narrative that said something other than we're not doing what we're supposed to do. I mean, it was difficult to fund agencies that really couldn't show us that they were going to move towards housing. And we also, that's when we got a good glimpse at the narrative not matching the data. And it was one of the first times we could see. We always had a feeling with some communities that maybe this narrative is not the full story, but to have the metrics, to have the point in time count numbers, to have all of that in front of us was very helpful to say, this is not an honest interpretation of what's happening. And so we're going to have to go in that community and work with them to try to help them get to a place where they understand their data, they can talk about it, and they can start to fix it. All right, and then keeping in mind, because I think it may have felt harsh to some communities when we came at them and said, hey, this is what your metric said, this is what your point in time count said, this is what your narrative said, this is how we're going to have to fund you, and we're going to work with you over the next year to fix this. We think people probably took something, you know, they felt some kind of way about it. However, if the end goal is housing people, if that's what all of our goals are, then there shouldn't be any personal feelings about a conversation that you're not housing people and we got to help you house people. It should be, we know and we need to figure out how to fix this too. Next slide. So when we were doing our scoring, again, we really looked at, and these are some questions directly off of our scoring tool. So we wanted to see, are they having positive performance and outcomes in those key things that we're looking at, in our goals? And as you see, the information given to the panelists was to review the metrics and the narrative. So we all individually reviewed this and came back and had discussions around the table. Some of the metrics were amazing, like in communities where we weren't sure what was happening, we were really impressed with some of the metrics. And some, we had people not even understand how to complete the metrics, and so it was difficult to understand. And that's after multiple trainings on how to do the metrics, which spoke to the COC local planning group's capacity for data collection, reporting, and outcome measurement, which is a very real thing that we have to look at, because that means we need to do more work in that community to help them to understand how to collect data, report, and measure their outcomes. Next. So with that, we have to build capacity. I think Virginia is very unique in that we are not just a funder. We look at it like we have to ensure statewide coverage, and we have to ensure people are getting housed. So it would be great to just sit and send people emails and just pay money, but it's better for us to be out in the community. We spend a significant amount of time as a team going out to do capacity building along with making sure the money is spent correctly. We visit board of directors to talk about things. So like we actually have something on my calendar for the Tuesday before Thanksgiving, which is odd, but to talk about the metrics and the point in time count and how Virginia looks at data for a board of directors meeting. So that's the kind of stuff that we're willing to do because that's how important this is. And we attend and participate in local planning group and COC meetings. So we're not just there as a visitor. We come there and we talk about what we're seeing and we talk about how improvements can be made. Because again, with the goal of housing people, like housing individuals, if that's your goal, then you're going to do whatever you have to do to reach that goal. All right, next slide. So some of the takeaways. We saw better outcomes for communities that tackled the issue of their long-term stayers. At first, like at the beginning, like the July, August, the metrics looked rough because they had these really high numbers of people staying and these long lengths of stay. But once they started saying, you know what, we can't leave people in shelter, because that was what was happening. There would be a difficult family or case to house. And so instead of really putting a lot of energy, it was focused on the people that are going to be easier to house, that can be housed in 30 days. That family's still sitting in shelter, not being housed. And until a lot of resources and effort was put into those families, those stayer families, I mean, we saw some as long as 365 days. That's concerning, but then they were housed, which means when you start looking at your data and you start to see, uh-oh, this is going to be a problem. Like, this is going to make our numbers look really bad if we cannot get some of these households housed. And we saw the agencies or the communities that really started to focus on their long-term stayers and getting them housed, we saw that they had really good outcomes. And some communities use that data to target their funding to agencies with strong outcomes. So as I said, a community plan is given to us, but within those communities, they have to decide who's going to be in this application. Well, a lot of lead agencies use that data to try to make decisions on who may be best to provide shelter. Maybe we don't need all 7 shelter providers. Maybe we only need 3, and we need to focus our energy on the 3, and those other 4 do something else within this realm of homelessness to try to help, but they're not the primary shelter providers. Or they saw that somebody wasn't applying for being a shelter provider, but they had really good metrics, and they were able to pull them back in, because a lot of communities didn't just collect metrics on the folks that they were putting in the application. They collected metrics on all shelters in their community to help them make a decision on who to target to see if they would provide the service. So as Cynthia and Ben had discussed, communities that use the data from their metrics and their point in time count, it drove their focus a little bit. It focused their energy. And that's what we like to see. We're going to continue to use the metrics because it's a good tool for us as a state agency and as a funder to be able to point to, and when we're having the conversations with communities, talk about their actual data. So with that, I will end my presentation, and I'm available for questions after Andrea finishes hers, or Andrea, excuse me.
Thank you so much, Nichelle. Really appreciate it, and some great insights. And of course, we love seeing that little shout out to the Metrix form that we helped develop, and that's what you all are using. So glad that that's been useful, and thanks for sharing your information. I'm sure folks will have questions, and we do have some questions coming in. We're going to get to those at the end. Keep sending those in. But in the meantime, I'm going to turn it over to Andrea and Northern Virginia Family Service to talk about how some providers have used data to make their shelter better. So Andrea, thanks for joining us. You want to take over from here, tell us who you are and how you're using data?
Absolutely. Thank you all for allowing me to be a part of the conversation. I appreciate it. I think we can go to the next slide. So my name is Andrea Eck. I am the Executive Vice President of Programs for Northern Virginia Family Service. Just a little bit of context for who we are. We started in 1924. We're a comprehensive nonprofit human service organization, multi-service organization. We provide services in the area of workforce development, early childhood education, housing, homelessness, immigration, legal, mental health, foster care. And we provide services throughout the Northern Virginia community. So 5 of the primary counties there, Alexandria, Arlington, Prince William, and Loudoun. So you can go to the next slide. A little bit of specifically about our homeless services. We actually, Northern Virginia Family Service acquired its first emergency shelter back in 2009 through a merger. And the Serve Shelter in Manassas is the largest shelter in the Prince William community. And I think in some ways we had a little bit of an easier transition to housing first and rapid rehousing because in 2009 when we acquired that shelter, we immediately implemented some of the principles of rapid rehousing and began to make some changes in policy and process and staffing and focus almost immediately. So in the Prince William community, we were certainly an early adopter of rapid rehousing, and the community's come a long way in the last 8-9 years in terms of all of the providers really shifting their focus in that direction. So as I said, when we came on board, we did a lot of research and had a pretty good understanding of where homelessness was heading. We have always appreciated and had a great partnership with DHCD as well as the Alliance, and have learned a lot from their research and their guidance. The state has always provided technical assistance and training and support and incentives to our community throughout this entire process. So we got to retooling our policy and processes. We made changes in staffing, as I said, even small things, changing staff titles from case manager to housing counselor. We eventually had all of our counselors become housing counseling certified. And we really, we changed the job descriptions, we changed shelter rules. We started to change the conversation about shelter, both internally within our organization and externally with our funders and our stakeholders in the community. And it was at that time we started to implement some specific interventions, for instance, bringing on board to that community the first full-time dedicated housing locator, a dedicated community case manager. And as the shelter began to look at focusing our attention from occupancy and how many bed nights, how many beds were full, or what was our occupancy rate, and what were the number of bed nights that we provided, to really looking at length of stay and exits to permanent housing. So we also were, for quite a number of years, have been the primary provider of homelessness prevention services in Prince William County. We were involved in some of the early conversations around coordinated intake. And then over the last couple of years, we were awarded additional contracts for emergency shelter and housing location in the same Prince William community. So you can go to the next slide. I'll just talk a little bit about over the last almost a decade, sort of how we focused on data and how we've used data to inform resource allocation as well as make decisions as an organization. So again, I mentioned that we shift our focus from occupancy and bed nights to length of stay and exits to permanent housing. And this was an important conversation to have with our funders, both at the local level, the city and the county, as well as with other funders that support the shelter. We really focused on the fact that our goal was to reduce the length of stay, knowing that this would have a greater impact on the children and the families that we were serving if we could help them return to stable housing and then help to build in the supports and resources around them in the community. We really tried to resist the urge to establish a one-size-fits-all response to our interventions. So instead of looking at our direct assistance funding and mapping out, well, every family will get, a security deposit in 1 month's rent or 3 months' rent. We really worked with staff to look at each individual family, look at their housing barriers assessment, look at their strengths and opportunities, and talk about what was the very individualized response that we could have to each household's episode of homelessness. And that was a challenge because you have a limited amount of resources and typically less resource than you need, and there's a temptation to say, everybody will get $1,000, or, everybody will get $500, but we really worked hard with the staff to make sure that each individual intervention was matched to the family's needs. So also, we had to do some problem solving given our really competitive rental market and the cost of living in Northern Virginia. So as we began to look at our length of stay, and when we acquired the Serve shelter back in 2009, shelter stays were, in the hundreds, 200 day stays. And as we saw as we retooled and retrained, and we started to see our length of stay begin to go down, we started to ask, how are we having this impact? And certainly, as Michelle said, to focus on housing and that shift in mindset from, sort of needing to address every issue and challenge that a household walks in the door with, to really immediately focusing on rehousing. But we also saw that we had quite a bit of success with shared housing in our particular community. So we started to pay more attention to how we could further develop our shared housing model, whether it was connecting clients with each other in the shelter or helping folks look for shared housing opportunities in the community. That's really a good solution in a very competitive rental market. So as we begin to look forward, our community has fully implemented a coordinated entry system. We have fully implemented across our jurisdiction a housing first approach. We are moving to low barrier, so we'll be paying particularly close attention to our data going forward to really understand if some of these changes in the system, or how some of these changes in the system might be impacting our length of stay, our exits to permanent housing. Also, as we move forward, for Prince William County, for a long time, Northern Virginia Family Service was really the only shelter looking at these data points. And now, since we have moved to, a more community-based model, I think it's going to be important for us to look at all of our data in the aggregate together. Look at each individual shelter, what they're doing, where they're having success or where they're having challenges, but also now, because we're all moving in the same direction, our aggregate data is really telling the true story of our community, and how do we learn from that in order to, as Michelle alluded to, does that help us with decisions around resource allocation, or if one shelter is sort of, struggling with a particular metric, what can we learn from other shelters, and really working better together. So I just want to share with you a little bit about some very specific data from this past year from the Northern Virginia Family Service shelters in Prince William County. So we currently operate 2 shelters in the community, the Serve shelter, which is 92 beds, and the LowBarron shelter, which is 30 beds. These are unique shelters in that they both serve both families and singles. So I think that presents some unique challenges as well. So far in FY18, which we're just about to wrap up, Northern Virginia Family Service served 951 unique households between those 2 shelters. So when I look at the shelters together in the aggregate, we have 52% exit to permanent housing and 46 average length of stay. 46 days is the average length of stay for both shelters combined. So, and these 2 shelters combined make up about 87% of the year-round shelter space in the jurisdiction. So when I look at each shelter separately, The 92-bed shelter had about 43% exits to permanent housing, and our average length of stay was 36 days. Over at the smaller shelter, the 30-bed shelter, our exits to permanent housing is higher, 61%, and our average length of stay is also higher, 58 days. So what that leads me to then further question is, are we seeing a trend where, I think Ben alluded to this earlier, are we seeing a trend where slightly longer average length of stay results in higher exits to permanent housing? So this is something that we're going to want to keep an eye on over time to see if there's any correlation between the length of stay and exits to permanent housing. What I want to dig into more to understand this data a little bit better is, what is the difference between, how does this data look if I separate out singles from families? So that's not data that I have right in front of me, but that's my next question for staff is, what do the exits to permanent housing and the length of stay look like when we separate out singles from families? And I also, I'm curious to know what's happening different between these two shelters. So essentially they're run by the same organization. We have the same policies and procedures and process at both shelters, but they have different outcomes. And so I'm curious to know a little bit more about what's happening, different at the smaller shelter than at the larger shelter, why our exits to permanent housing are a little bit stronger. And then that's how I go approach the data in terms of learning from it and understanding what's going on in our shelters from an organizational perspective. From a community perspective, as I said, this gives us the opportunity to look across our homeless service systems and identify strengths and challenges. And while I don't think that we've accomplished this yet, I hope that this kind of data is used to help inform resource allocation going forward. And it's this data that has helped us inform our benchmarks for the coming year, which Nichelle mentioned being a part of the application for the community, the most recent community-wide application that was submitted. So, across our organization, we look at our data, not just in homeless services, obviously, and hope to move towards a process of using data to help us better inform resource allocation throughout our entire organization, not just within homeless services, but in a community where there's competition for resources and there's always more need than you have resource available. Across the organization, we hope to use data more to inform how we make decisions about fundraising and where we put our allocation of resources in general. So that's all I have, and I'm happy to help answer any questions there might be.
Great. Thanks so much, Andrea. Really appreciate that. And, I think it's really helpful to hear. You've really helpfully summarized how Northern Virginia Family Service you've put into practice what Cynthia talked about a little bit earlier, which was using your data to set some goals to yourself and then look at the data again and say, did we achieve these goals? Did we not? And make adjustments and then rinse and repeat. So data is only as good as what you do with it. So thanks so much for talking about how you all put this data into practice, get it off the page and worked into your programs. So with that, we have about probably 5 or 10 minutes for a couple of questions. So we've had several come in. So give me 1 second to just kind of pull up some of the ones that have stuck out. So here's a good one. Nichelle, this may be best to you, but others can jump in if you have things as well. Somebody says, we found that average length of stay is a poor measure for our program, while median length of stay is a much better measure. Have you had this discussion with funders about what to measure?
So I can speak from being a funder. One of the things we're looking at is we're dealing with shelters, and Andrea described this, small little shelters and really large shelters. And so the average is the best way to calculate this over the median so we could get a clear picture. And it also, I hate to say this, but it helps agencies and communities look at their long stayers and try to get those down, because if you have somebody staying 350 days, that's going to throw your average off. You don't want that outlier thrown out. We need to see that, and you need to focus on trying to keep that from happening. So I think that the average really gives us the best picture, and it helps everybody stay focused.
Great, thanks, Nichelle. Another one on a similar path. So when you're talking about what were the key points that helped shift the focus for funders from occupancy to length of stay and exits to permanent housing?
Can you repeat that?
Yeah. So let me see if I can reword it. So it says, what were the key points that helped shift the focus for funders from occupancy to length of stay and exit to permanent housing? So I guess you talked about this a little bit, Nichelle, but what helped? So you are the funder, right? So what helped you make that shift? What was compelling for you about looking from just occupancy, bed nights, keeping shelters full, to looking at length of stay and exits to permanent housing?
Okay, that's what I thought you were asking. And then I thought, wait, am I missing something? Okay, so what I can say is when we started shifting that conversation from sheltering people, which is what all homeless services have been about for decades, right? When we started thinking, instead of just sheltering people, having a roof over their heads, and people didn't think past that point, or they thought about the roof over their heads and all the things that brought them into homelessness. When we shifted our thinking to housing, right, then it changed the conversation, and it helped people get housed. Like, you start to see the numbers of people being homeless go down. So I feel like once we had that conversation amongst ourselves, then we could start dispersing that conversation around the state, and it became the focus of every category of funding we have. So in our prevention category, in our outreach category, everything should be about housing. And I feel like once we stop looking at shelter and just, utilization rates and those kind of basic things and those outputs, and really started looking at outcomes, that's when we see the changes like I showed you in Virginia. And we can see in the communities that have not shifted yet, we can see where they're still kind of stuck.
Great, thank you.
I can contribute to this answer too a little bit from the provider perspective. I think for us, with our funders, I mean, obviously the state was telling us what to focus on, so it wasn't a problem convincing Michelle. But at the local level, we have local city funding, we have local county funding, and then we have foundation funding as well. So at the local level, it was really important. They were going to collect data on something. They had to measure us against some metric. So we gave them an alternative metric and told them the reason why this was important. So instead of looking at, our 80% or 85% or 90% of my beds filled every night, or how many beds did I provide to your community a night, let's change the conversation and think about homelessness as an emergency, as a crisis. So we want to try to minimize the length of time a family is in this crisis. And then also sharing research about the long-term impacts of homelessness on children. So when we shift the conversation and we say, homelessness is a crisis, it's an emergency, we have to limit the amount of time that this household is in crisis. We need to get them out of shelter and back into stable housing as quickly as possible. So measure us against the length of stay and exit to housing. But then talk about, Nichelle mentioned not addressing every issue that brought them into homelessness. Those things don't go away, but talk about how we're going to then wrap services around the family once they're back into stable housing in the community. So we're going to provide community case management. We're going to make sure that they're connected to all mainstream resources, that we've connected them to workforce or mental health or whatever it is that they need to help keep them in the community. So I think it wasn't a difficult conversation to have. It was just, we had to be consistent about it. And what really helped us was the consistency between, sort of the research and the information that we were getting from the Alliance, that, we could see the direction that HUD was going, that our state and our housing and community development in our state was headed in that direction. So there's a lot of consistency, and the path was really clear. Like this was the direction that we needed to go. So that was all part of the conversation that we had with our local and our private funders.
Great, thank you so much, Andrea. This question is probably best for you. And we've heard this a lot at the Alliance in some of our work with communities who are struggling to track exit destinations. So we're asking folks to report on the number of people that have moved to permanent housing, but I know sometimes it's hard for folks to know, for shelters to know. A client may just leave and you don't know where they went. So what do you do to help track that? What do you do if you're not sure where somebody goes, if they leave without notice or without sharing their destination? Can you talk about how you obtain that information?
So I will start by saying that I don't have the solution to this problem, but I can tell you some of the practices that we do to try to minimize the amount of unknown exits. And this is, I would say, this is for individuals and families. I don't think that this is an issue just for serving individuals, but we have a couple of different methods. We ask folks to complete an exit survey when we're leaving. This looks at customer service as well as their destination. We make it available to them. We leave it under their door. They don't have to connect with us when they're leaving in order to share that information. Also, we may learn that information about where folks went from their peers in the shelter. We also, I think it's part of it is building that relationship with folks that, to just check in with us before you leave, when you decide to leave, let us know where you're headed, check in with us, and whether you want to engage with community case management after you exit, we're going to call and check in with you and see how you're doing, see if there's any additional supports that you need. So both through the relationship that they have with their case manager, they may have, a stronger, different kind of relationship with staff that work on other shifts. They may be able to give that information to us through survey without having to actually connect with us when they leave. But it really does, it helps if through that relationship you can tell them, why it's important for us to know and why we're asking and why it would be helpful if they could share that with us before they left. And we have seen some increases in or decreases in our unknown exits.
Great, thank you. I think we have time. It looks like we have about maybe two more quick questions. Let me pose this one to you, Cynthia. So you mentioned the difference between sort of a housing-focused shelter, a shelter that is focused on ending homelessness versus a shelter that's just kind of focused on sheltering people for the night. So this question says, for outcome measures, keeping in mind that tracking access to housing and other data is always important, would you suggest different outcomes for shelter whose primary role is to connect clients to coordinated entry and do not have any of the housing assistance in-house or sufficient staffing or funding to case manage? So they follow up, would outcomes include something like a number of clients connected to coordinated entry, or how quickly they're connected to coordinated entry? Another question came in about like tracking returns to homelessness or returns to shelter and recidivism. So I don't know if you can speak to that at all about developing these metrics and how other shelters might adopt some of these and not others, or add additional metrics, and what your thoughts are on that.
Sure. I think that thinking about what your shelter is trying to achieve is the best place to start, as we said earlier. And if the goal of your shelter is to make sure that people get connected to resources so that they ultimately can get housed and not return to homelessness, yeah, you can sort of look at some of those outcomes in the ways you just mentioned. So if your role in your communities, your shelter, and I want to say that I don't think this is just a question for the shelter. I think this is a question for the whole system, right? So while the shelter is certainly it has to decide what itself wants to do and what its what its leadership and board and staff want to do, it's also a question for the system. What role do you want the shelter to play? Now, if you want the shelter to be a place where people are temporarily housed while you are trying to connect people to coordinated entry, well then yes, you should definitely figure out how you can work closely with coordinated entry to measure how quickly people can be enrolled in shelter from coordinated entry, how quickly they can be connected to coordinated entry once they are in shelter, as you mentioned. And then I think it's important for the system and the shelter to track, well, what happened to that person? If the shelter can't track the sort of whether the person got housed, that's something the system can do to see if the shelter is playing the role that it should, it wants it to play. And then the shelter can track whether people are coming back to their shelter. So tracking returns to shelter, who your repeat users are, that can be really helpful. So I've seen shelters who are simply tracking their sort of frequent flyers or repeat users. And so just like you look at your long stayers, you might say, well, why is Bob Jones come back, 5, 6, 7 times? What can we do to, just knowing that Bob Jones is coming back 5, 6, 7 times, or however many times, what can we do to break the cycle of him returning over and over and over? That alone can be kind of an important metric to track. And also, it's sort of still focused on resolving his housing crisis permanently, so you're not sort of serving the same person over and over. The length of time Bob stays in your shelter, that's still an important thing to track, even if you're temporarily sheltering people. How long are they staying? Is this turning into more of a transitional housing or an affordable housing place where you're not able to serve that many people because people are staying for so long? And how can you break that cycle? So there are things that you can sort of track, I think, even if your goal is to temporarily shelter people. And one thing that people look at is how many resources the person has been connected to. Were they connected to benefits? Were they connected to coordinated entry? Were they connected to, did their income go up while they were in shelter? So there are other things to track that I think ultimately help stabilize people. But again, as I said, this is not just a question for shelters. I think it's a question for the whole system. What role do you want each of the shelters in your system to play?
Great. Thanks, Cynthia. So last question, and I'll pose this to each of you, perhaps maybe a little bit differently. So for folks who want to do this, who really want to dive into their data, I imagine this is a somewhat time-consuming task. So just wondering, I know sometimes folks worry, like, we don't have the staff to do this. We don't have the, we're going to need more resources if we want to do this. We're going to need more money if we want to really take a dive into our data. So I don't know if perhaps maybe, Nichelle, you can speak a little bit to the funding side, like how have you empowered providers to do this? And Andrea, if you could speak a little bit to how you've worked this into your workflow at Northern Virginia Family Service. So maybe Nichelle, we'll start with you, and then Andrea, if you have anything you want to say to add on.
Okay, so and we get this question a lot, just in terms of not just how to look at data, but how to carry out all of these different duties related to housing folks. And we don't have any new money. So we're very clear with that at all times. We're like, there's no new money. However, you're still going to have to do these things. And what we found over time is when communities, specifically communities, start to strategically target the funding that they have. So instead of every shelter gets $50,000, they really target it to where they're going to get the biggest bang for their buck, where more people are going to get served and permanently housed, and they start to really focus those efforts. Then you have more people freed up to be able to look at the data. But again, no new money. And I think if we all, and we say this at the state level, if we look at how we're doing the work, we can be more efficient. There's always places where you can find efficiency. And so we did that as a team here. It's only 7 of us for the whole state. And we found a way to be more efficient. And that's including our associate director. So there's really 6 of us, 5, that are doing a lot of the work on the ground, but we're figuring out ways to do it more efficiently. And we have the same expectation of the communities that we provide the funding to look at ways that they can strategically target their resources to meet the greatest need and the people who are most vulnerable without cutting off anything that they need to do.
Thanks, Michelle. Andrea, anything to add?
I mean, I think I think we've all in the nonprofit field have, if we haven't already, we have to figure out how to make the collection and analysis of data a critical function of our organization, regardless of what kind of work we're doing, because we have to be able to tell potential funders and investors what it is that they're investing in, beyond stories, which are very impactful as well. But we have to be able to use our data in a way that tells people what kind of impact their investment in our organization is having, and that's a priority of our organization, but also because we need to know and understand whether the interventions that we're deploying are working, or which interventions are working and which interventions are not working. So within homeless services and within some other departments in the organization, we have over time either built in positions that work across a number of areas that are tasked with looking at data, helping us with the reporting, presenting data in a way that we can look at it and analyze it and understand it. We have supervisors, as Michelle said, it doesn't, we don't always have the luxury of like having one person for that task. So it will fall to a supervisor or a manager or a director. It's really everybody's responsibility to be able to look at the data and understand what's going on. So I think we have to prioritize it as a field in order to continue to make the case for what's working and what's not, and why people should invest in the services that we're providing.
Well, thank you so much, Andrea. I can't think of a better way to wrap this up than that data can be and should be an integral part of knowing whether what we're doing is successful in ending homelessness or not. So I think with that, we're at our time. So I just greatly appreciate your input, Michelle and Andrea and Cynthia. Thank you all so much for sharing your wisdom and insight with us today. And thanks to all of you for joining us. We hope this has been helpful. As Cynthia said, we'll be back with another webinar shortly on HUD's Equal Access Rule. So we hope you can join us again for that. And with that, I will wish you all a good day, and thank you so much for joining us.